Today's Gulf Coast Hot Tip will demonstrate how to image the origin of the renal arteries from an alternative coronal approach, the banana peel sign. In most individuals, the renal arteries arise laterally from the abdominal aorta, immediately distal to the origin of the SMA. The right renal artery passes posterior to the IVC, and often the right ostium is slightly more cranial than the left. Now remember, the basic physics of ultrasound teaches us that the best 2D image of a structure is achieved when our structure is 90 degrees to the ultrasound beam. However, this is not an appropriate angle for Doppler interrogation. During a difficult exam, this can drive even the most seasoned sonographer totally bananas. But don't go bananas, and instead remember the banana peel sign, this alternative imaging approach to the renal arteries using a coronal scan plane. Now let's go scan and see how this works in real time. What you're going to do is, instead of coming from a more anterior traditional approach, we're going to have the patient turn decubitus, and we're going to place our transducer along the flank so that we have the ability to scan through the right lobe of the liver and the inferior vena cava to visualize the renal arteries. Let's look at it on the ultrasound image. Placing the transducer in a coronal position with the indicator directed towards the head, we're going to scan through the right lobe of the liver until we can visualize the inferior vena cava. What you're looking at is we're utilizing the right lobe of the liver and the inferior vena cava to scan medial until we're able to visualize this small structure posterior to the inferior vena cava. That cross-sectional structure does represent the right renal artery. We're going to use that right renal artery to guide us back to the aorta by angling just a little bit more medial. Here you can see the origin of that right renal artery, and with a slight rotation of the probe, I'm also able to appreciate the origin of the left. Now, placing on color, we're able to appreciate the origin of both the right and left renal artery coming off, peeling off of the aorta, the banana peel sign. That's your Gulf Coast Hot Tip of the day, and remember, keep learning fun. Now it's your turn. Let's hit the beach.